Amy Cohen. I don't know if you've heard of her, but you might want to Google her. She is the first person with sickle cell disease, sickle cell warrior, to run and complete a marathon. Not the least of those is the New York City Marathon. For those who may not be as familiar with sickle cell and the kind of the mechanisms of the disease, but the whole point is it cuts off oxygen to your muscles and your organs, and that causes severe pain. Running makes your muscles scream for oxygen. What in the world prompted you to say, I'm just going to start running? Forget the marathon yet, but just running.
I moved to Massachusetts. I got connected with my now hematologist, Dr. Azar. He has this amazing program, which includes an exercise specialist who I actually ran with, Jen Miramontes, who is, again, amazing. She's also a superwoman because that was her 82nd marathon. She asked me, like, what are your goals? And I literally spit out, I want to run the New York City Marathon. She paused. I thought like her internet connection had like just dropped, but like, no, she was just like frozen. It's so interesting reaching the finish line because I envisioned myself like crying, just having like this moment. But I was in such shock when I crossed the finish line. I was like, I really did it. Like, I thought I was just like talking mess. Like, I actually did this. Live life boldly. Just because, you know, with sickle cell, like a lot of people will tell you like what you can and can't do. And it's crazy. It's like people who don't live with the condition will tell you what you can and can't do. But if you know in your heart what you can do, you have to act on that and act on it with confidence and also have the discipline to execute.
This is Genetics for Healthcare, a podcast for patients.
Welcome to another episode of Genetics for Healthcare, a podcast dedicated to patients and their family members, their caregivers, to help them learn the language of genetics and genomics and build the confidence to become more effective advocates for using this information to make healthcare decisions, which includes disease screening and prevention, treatment, and survivorship. You can find us at geneticsforhealthcare.com or wherever you get your podcasts. While you're there, especially on the YouTube channel, click that subscribe button so you can get updates on the many great guests and episodes that we air like this one. Today, it is a huge honor to meet, get to know, and have Amy Cohen. She is, I don't know if you've heard of her, but you might want to Google her. She is the first person with sickle cell disease, sickle cell warrior, to run and complete a marathon. Not the least of those is the New York City Marathon. And my goodness, Amy, thank you for coming on and sharing your Genetics for Healthcare journey with us to help our audience. Thank you for being a guest.
Yeah, thank you for having me and the invitation. It's an honor for me as well.
So tell us about your growing up battling, being a warrior against sickle cell disease. How did when you first diagnosed, and how did it affect your quality of life, your ability to do the things that you wanted to do as you were growing up?
Yeah, absolutely. So I was very lucky to be born in the state of New York, in New York City to be specific. So I benefited from the 1975 bill that became law that was that every child born in the state of New York had to be screened for sickle cell, which was the first state to do that. So I was born in the 90s. So we pretty much knew my entire life that I had sickle cell. But my experience was a bit more unique because I didn't have my first crisis until I was 14. So my entire life, I always knew I had the condition. Every year I'd go to Texas Children's. I grew up in Houston, Texas, and, do my blood work and just go on my merry way. So I had a very normal childhood. I played, sports. I played outside after I did my homework. In terms of sports, I was playing tennis, volleyball, soccer. I played instruments. Like, I just had a very normal childhood. So it wasn't until, my freshman year of high school where I started having crises, which flipped everything on its head. Because I went from like just being a carefree child to like oh, this is what sickle cell means. So it was a rough transition, but I always had this like reference of like, this is how it was. So let me work toward getting back to that pre sickle cell, well, pre crisis phase of life.
When that happened as a freshman in high school, and you became knowledgeable about the experience of others, because we live our life as an N of one, in life. But what did that do in terms of your outlook? Did it caution you for doing other things? How did that affect your outlook?
Yeah, it made things like harder for me because like there's still things that I wanted to do in spite of, having all these crises because I would have crises from like September to like March, April. So I was like, I still want to like go to homecoming. I still want to like hang out with my friends and stuff like that. Just having these crises like back to back, like literally every month just made things a bit more difficult, but it encouraged me to work harder to find a solution because to me there's no way I was okay for all these years and now I'm getting sick all the time and that's just going to be the rest of my life.
So did that experience kind of inspire you to have a career in healthcare? What attracted you to the healthcare field?
Yeah, yeah. So, I mean, growing up in Houston, healthcare is just like such a big deal. It's so funny because I initially wanted to be a doctor, but like I wanted to do things outside of just like treating patients. And in Houston, it's just like doctor, nursing, and that whole thing. So it wasn't until I went to college and like I learned about public health and just all the amazing things that you can do with public health. It got me interested in just like a different avenue of healthcare and then going to New York for grad school at NYU, just learning things on more so a global scale and just having, the opportunity to one, work for the city of New York during COVID, which was in retrospect a great honor, but going through it, I learned so much in such a short amount of time. And also transitioning, I know it was insane. Here we are to tell the tale, but also moving to Massachusetts, working at Mass General and, applying like all that community engagement, patient engagement, knowledge that I've learned along the way. In addition to being a patient, it really did help me, find my niche, one, and also just a way to help people because that's always been like the theme of what I wanted to do with my life. I just want to help people.
Tell us about the work that you did in healthcare, and the work that you did there at Mass General.
Yeah. So, I mean, I'll start with like New York since I did mention that. So, I was a community engagement supervisor for the city of New York and New York City Health and Hospitals, which is like the biggest public healthcare system in the United States. So, I had a team of like upwards like 27 coordinators who were knocking on the doors of people who had or were affected with COVID. So we learned a lot very quickly about just people's temperaments, about the pandemic, also just what people were going through. Because oftentimes you would reach out to people and like they have no one to talk to, they're isolated, and they have like a myriad of experiences going on. You have like the one college grad that's just like scared to like walk outside versus, someone with a family who is scared to like not go into work out of fear of like retaliation or something. So I learned a lot in that setting. And at Mass General, I was the community and site engagement project manager at MGH. So we were working on a NIH study called EpicNet. EpicNet was created to find alternatives for opioids. And as a sickle cell patient, I was very, very excited for that because I always say the worst part of having sickle cell and having a crisis, namely, is the drug options or lack thereof, because 9 times out of 10, it's going to be an opioid. And it just makes the experience so miserable.
I want to get to, and I know that you mentioned you played sports and in your childhood was certainly active, but for those who may not be as familiar with sickle cell and the kind of the mechanisms of the disease, sickle cell pain happens because of the sickle shaped red blood cells will get sticky and block blood vessels in the body. But the whole point is it cuts off oxygen to your muscles and your organs, and that causes severe pain. And I believe that's what's described as the vaso-occlusive episodes. Running makes your muscles scream for oxygen. This is why I wanted to have this conversation, because you're a superhero. You present yourself as very much Clark Kent-ish, if I can say that. But you're Superman. So just help me get through what in the world prompted you to say, I'm just going to start running. Forget the marathon yet, but just running. What was that like?
Yeah, so it's so random, but like people that know me know that like I oftentimes have like these like grand ideas in terms of like what to do in life. So basically we grew up watching Oprah Winfrey like growing up. So I'll never forget the episode of how she recounted on her experience when she was training for a marathon and then ran it. And that memory just stuck with me because, like, growing up in Texas, as you know, there's not really a running culture. Maybe now, I guess. But I just held on to that memory because I thought it was so cool. Like Oprah's like running a marathon. Like she does things outside of like interviewing people, which is like super cool. So in middle school we had like track and cross country. I wasn't really interested in those. But moving up north, especially like when I moved to New York, people are always running. And that memory came back to me, but unfortunately, COVID happened. So after COVID happened, I moved to Massachusetts. I got connected with my now hematologist, Dr. Azar, and he's amazing. One, but two, he has this amazing program which includes an exercise specialist who I actually ran with, Jen Miramontes, who is again amazing. She's also a superwoman because that was her 82nd marathon.
E.
And exactly. And she ran a marathon the weekend before. So she was just, I don't even know, honestly, till this day. So she was doing amazing things. But with that, I connected with Jen and we had like our first meeting, a part of the sickle cell exercise program for the Sickle Cell Center at MGH. And the last part of the meeting, what she asked me, like, what are your goals? And I literally spit out, I want to run the New York City Marathon. So with that, she paused because it's so funny the way she pauses. I thought like her internet connection had like just dropped, but like no, she was just like frozen. Because like for her, when she's talking to, warriors, it's namely like they want to, walk up the stairs without getting winded or, walking down the street and like not like aching or things like that. But I was just like very bold in terms of like just what I wanted to do. And watching someone like Oprah growing up and just like having a chronic illness, like this is my only life. So, I mean, if I can do it, why not? But it was definitely a process, I will say.
I just the idea of the boldness that you had. I've always said that in order to live a life beyond your wildest dreams, you first got to have wild dreams. you know and that, once you speak those things, when you have that thought and you have the courage or the unction to put those things out in the atmosphere, that's how they become real to you and others around you. You mentioned the she pause. What was the reaction like from other clinicians and your family members when you said, they were made known that you wanted to actually run a marathon?
Yeah. So Dr. Zar, who's my hematologist, he actually gave us the green light to do it. It was all predicated on his decision. So he told Jen if she can get me across the finish line, then I can do it. And with friends and family, I think they're just so used to like me just having these grand ideas that they're like, okay, it's just something else. So it was fairly positive on all ends.
Okay. So it's one thing to say you're going to run, because that's a mindset shift. You have to shift habits. You got to change your diet around, like get all those things that you don't really think about. It's another thing to start running and to say, I am a runner. Okay. And it's a whole nother level to go out and run a marathon. Tell us about your mindset and what you had to do in terms of the shift of your thinking, or to expand those limitations. How were you able to do that?
Yeah. So first, I will say it's been a 3-year process. So we started the entire process in March of 2023. 2, 3 years? Yeah, March of 2023. So it's been 2, 3 years almost. But in terms of, like, mindset and just that shift, like, I just really wanted it, and I'm someone who, like, when I really, really want something, like, I will hunker down and I will do it, which meant that I had to wake up at 5:30, 6 in the morning to go run my miles. I had to wake up really early on Saturdays because those are my long miles. It was a lot of sacrifices. Like, there was a point where, like, I just wasn't doing anything but running on the weekend and recovering on the weekend. But it's something that I really wanted. And I'm also the type of person that, like, I mean, we're all going to have regrets in life, but I don't want to regret something that I knew in my heart that I could do. So that was like my motivation to keep going, to keep doing it. Because there are sometimes I was just like, I don't even want to do this anymore. But it's like I'm promising myself, you know. And as attention got brought onto my story, and I realized like I would be the first because that wasn't the intention of doing it. It was just like I just wanted to do it as like a childhood dream. I realized like it's not even for me at this point, it's for the community because we have such a rough time. And just to have a win for the community, like again, it's for them more than it is for me.
That bigger purpose, that idea, did it pull you through?
Oh, yeah, absolutely. Because with sickle cell, especially since I didn't really grow up with an ecosystem growing up, and I have that here, and just seeing how many of my peers like are going through the worst of the worst conditions, but they still show up every day. I have friends that are like my age that have had hip replacements, shoulder replacements, are consistently like in and out of the hospital, but they still show up in spite of everything that they go through. So that was motivation for me as well. Cause I'm like, my last crisis was in April of 2024, and I managed that from home, which is such a blessing. So I can get up at 6 and put on my clothes and like just go run and do what I need to do.
I was going to ask, like during that training process, the 3-year process, did you have crisis? And even if it's not an all-out crisis, I'm sure you're familiar with your body to say, okay, something's off, or before it becomes full on. What was that like, trying to manage those symptoms and still stay in shape to run?
Yeah, absolutely. So I never had a crisis while running, thankfully, because I was very big on like my hydration. I have my waters, I have my Gatorades, I have my coconut water at home. But the first time I ran 20 miles, I knew I had to switch things up because after that run, I was just like, I'm going to have a crisis if I don't like basically like throw down however many water bottles I can and just stay hydrated, rest it up. So I had to switch my strategy. So I switched from Gatorades to electrolytes before and afterwards and just like rested and made sure I had like a really like nutritious like meal. Like I'm a really big fan of like grain bowls and like I'm not sure if they have them in Texas, but like sweet green.
We do, actually. You can imagine that it's probably not as popular as Whataburger, but we got them.
Probably not, and I miss my Whataburger. I love Whataburger. So there's this thing I get anytime I'm in town. I have to get my
Yes.
patty from Whataburger.
Okay, so you, I, I'm a big mindset guy, and I'm just so very intrigued about your story, about how you shifted and that you wanted it, and that when it got hard, it just became bigger than you. But here you are, the day of, you're running um, the marathon. And when you get over the hump and you're like on the downside of that, and you know that you're coming close to the finish line, what was that feeling like? What was going through your mind at that time?
I can't even describe the feeling. It was like a mix of like pride, a mix of just like being emotional, being really happy I did it, and just being happy I was like almost done because I was like over it at that point. But it's so interesting reaching the finish line because I envisioned myself like crying, just having like this moment. But I was in such shock when I crossed the finish line. I was like, I really did it. Like, I thought I was just, like, talking mess, like, I actually did this, And again, it was for the community more so than me that like we got this when someone with sickle cell disease was able to run a marathon. And if I can do it, honestly, you can too.
How does this feed into, because obviously this has made your platform much bigger for all the right reasons, and you have an organization for which you do consulting and patient advocacy work. Tell us about that.
Yeah, so I have a consultancy called the Patient Room. So, what I'm primarily trying to achieve is to bridge the gap between pharma as well as patients because there is a huge gap. And as someone that sits in that intersection, it's very interesting because on one end, pharma is working like really, really hard, doing all the right things, bringing patients in and just trying their best. But on the other side, like patients just don't know what's going on. And I'm not talking about the sickle cell patients who are on LinkedIn following these pharmaceutical executives who are announcing like all the latest and greatest things that they're doing. I'm talking about like the average sickle cell patient who maybe in and out of the hospital is struggling to keep a job, trying to manage like family finances and all these things. They just don't know what's going on. So my aim is to bridge that gap because I think that for me we all have to work together, especially in a time where there's so many therapies going on and unfortunately some of them aren't coming to fruition. That we just need to work together and that's the aim. And my angle is just centering it around trust. Because for sickle cell, I work with all conditions, but for sickle cell specifically, 90% of warriors are Black. So, as you know, there's a lot of historical distrust and even modern day distrust that has affected the Black community. So, I'm just trying to bridge that gap because context is important. And, in these spaces where there's not a lot of people who look like us, it's very important that someone who looks like the patient population, as well as someone who has a condition, can speak to the patient experience and also bring those patients in. Because I don't think one person can represent the entire, in this case, sickle cell experience, just because like my experience is unique. Like I literally just ran a marathon. Like that's not the average sickle cell patient experience versus someone who, may be on the other side of the spectrum, who may be going in and out of the hospital more frequently. That doesn't reflect on my experience because I'm also someone who doesn't qualify for any sickle cell clinical trial because I don't really have crises as normally as other people. So it's just doing that and just making sure that all perspectives, or as many perspectives are as possible, are in the room.
That's awesome. I'm going to put a pin in that research conversation. I want to double click into that in a second, but your consultancy, your consulting firm, and your patient advocacy work, you guys are also doing work on the legislative level. The Affordable Health Care Act, the Affordable Care Act, has been in the news all year, and it's lost the subsidies that pay for a lot of healthcare benefits for a number of patients or a number of people who are battling chronic diseases. How does the loss of these ACA subsidies impact the sickle cell community?
It's going to be devastating, not only for sickle cell, but anyone living with a chronic condition. Because with sickle cell, we have so many doctor's appointments. And I'm someone, again, I haven't had a crisis since April of 2024, but every year, well, every quarter, I still have to see my hematologist. I'm seeing my ophthalmologist. I mean, I'm a woman. I have to see the gynecologist. I saw a cardiologist, neurologist, like all the ologists, and all that costs money. So it's gonna impede on people's accessibility to care, and it's going to lead to worse health outcomes because if you're not regularly getting things checked out, then anything can happen. And as the world is becoming what it is, it's being more stressful for a lot of people in terms of like rising housing costs, cost of food, and just like different things that will impact your health. Like one of, a lot of people with sickle cell triggers is stress. And if you don't have, access to support for stress management, it just makes things a lot harder. So I think health outcomes, unfortunately, are going to get worse. And also just resources at hospitals. Because I mean, there's a budget, and if patients aren't coming in, or, however things manifest, because a lot of hospitals are having layoffs, it's going to be harder to have resources. Like I mentioned, my hematologist in his clinic, he has an exercise specialist. And I'm wondering, like, will Jen be there this time next year? And we have like a social worker, so many things, like, will these people and will these resources be there in a year's time? Because things are shifting so quickly.
Tell us about the work you're doing at the Massachusetts state level to advocate for these benefits for the sickle cell community.
Yeah, absolutely. So we are advocating for an act to improve sickle cell care within the state of Massachusetts. Namely, it's going to make gene therapy more accessible to warriors who have or are who are on Medicaid. Our Medicaid system is called Mass Health. So, with that, in the state of Massachusetts, 60% of warriors are on Mass Health, which is very significant. And there are warriors who are interested. It's just like the cost. When you see a sticker price of like 2+ million, 3+ million, like, I personally don't have that. But it's interesting because like people are interested in it. But one of the factors again is cost. So, if we get that bill to pass, not only is it going to make those treatment options, gene therapy, more accessible, but it will also open up greater conversations surrounding, treatment options for sickle cell patients. Just because, like with the gene therapy, what a part of the bill is, egg preservation for women, because that's very important, and just like having a lot more conversations around the sickle cell experience, I believe, outside of, the warriors.
Around the topic of research and access, there are long gaps in development in new therapies for sickle cell. And now we have gene therapies, gene editing. There's new therapies in the pipelines that have been a beacon of what's possible for bringing cure and more effective therapies to chronic diseases as a whole. But now that there are more therapies than there ever has been before, and cure is possible for some patients, there still is a huge gap in access. And with the restriction in subsidies and Medicaid funding to be able to help patients access these new therapies to improve their quality of life and improve their health, like, what needs to happen to keep the energy and the patient demand for research?
Absolutely. Yeah, we all need to work together. Again, like, nobody can do anything, like, independently, whether it's, like, patients, we need the pharma companies, we need the policymakers, vice versa for, like, the policymakers and pharma. We all need to come together, and we all need to be on the same page. I think that's, like, very, very important now, and just have a common agenda rather than, like, everyone working on their own independent projects, because, like, we're stronger in numbers rather than, the patients want one thing, pharma wants the other, or whoever wants the other, caregivers, their inputs all also important. But yeah, we just need to work together moving forward.
It helps that there are warriors like you that are breaking barriers, that are doing just incredible things to stretch people's ideas of what's possible, even living with chronic diseases like sickle cell. In fact, you mentioned Dr. Azar. So this is a quote that he had, I believe it was in People magazine. Again, you need to Google Amy Cohen, by the way. She's like that. But here's what he said, and this applies to like keeping the energy going around this idea of development of new therapies for sickle cell, and making sure that patients have access to them, because at the end of the day, it doesn't mean anything if patients can't get access to it. But he said that Amy's accomplishment will help our sickle cell warriors achieve whatever they want. That's deep. And that's from Dr. Charles Azar, the medical director of the Comprehensive Sickle Cell Disease Treatment Center at Mass General Hospital. I love to ask our guests for 3 practical tips for those who are watching who have a lived experience with sickle cell disease. But again, Amy, your story it transcends the sickle cell community to any forum of transcending a mindset and perceived limitations. So I'll ask you if you could give 3 practical tips to help someone develop a mindset to push through to new levels that others may not think is possible for them, or they struggle thinking it's possible for themselves. What would those 3 practical tips be that you would offer?
Yeah, I mean, you named the first one, which is pushing through. Like, it's so important to not, for me especially, it was very important to not say that I can't do X, Y, and Z because I have sickle cell and to live in fear. Because there's so many things I want to do in life. And again, there's like no reset button in life. Like, this is it. So you just have to make the best of your situation, whatever that is, and just try to figure it out. Like I said, like it took almost 3 years for me to run a marathon. Like, this didn't happen overnight. Like, I was on Team Inspire for the New York City Marathon, and they hand select 26 runners with just various stories. And one person on Team Inspire, she literally started her marathon training 10 weeks before the marathon. And that's just, it is what it is. Like, I don't feel bad because I had to start sooner or anything. It's just like, it is what it is. This is my situation. And we're all in the same place. So it obviously like worked out. My second tip would be to live life boldly. Just because, with sickle cell, like a lot of people will tell you like what you can and can't do. And it's crazy. It's like people who don't live with the condition will tell you what you can and can't do. But if you know in your heart what you can do, you have to act on that and act on it with confidence, and also have the discipline to execute whatever idea that is. And lastly, we do have to work together. In terms of sickle cell, like there's no way I could have ran this marathon by myself. And that's just being honest. I was very like lucky to have Jen, who is a pro with the marathons. And even on those runs, like she would say like, oh, there's like a water station coming up. And we had like a strategy. At first I was like taking a sip of water and a sip of Gatorade. Then it manifested into, water or Gatorade and just like different things like that. So it was nice to have her as a support system, not only for the marathon, but throughout the whole process. Like Jen's the one that made my exercise, my running plan, and which we would always check in with each other. And of course, I went to Dr. Zara every quarter, and we, did my blood work and checked in and things like that. So you have to work together in community, especially with a condition that can make you want to isolate yourself. You still have to like just put yourself out there and ask for help. And, when you do have like proper help and people who like love and care for you, just hold them close because they do want to see you win.
I love that. Amy Cohen, the first sickle cell warrior to run a marathon and completed the New York City Marathon. I can't imagine what that's like. And we were talking before we went live about your favorite hobbies. And you said running is not even your favorite hobby, but you do love to bake. Like, what are you baking? Like kale chips these days? Like,
Oh no!
running.
Oh no! I'm eating all my unhealthy foods. It is winter. I just made some pumpkin cinnamon rolls a couple of days ago, and I've been eating them all. So I'm very happy. But yeah, I love to
needless
bake.
to say, you can always say, "Well, I can burn it off."
Oh yeah, yeah. Not in this weather, but maybe in the springtime.
Amy Cohen, thank you so much for sharing your story and inspiring our listeners. Thank you for much being a guest on Genetics for Healthcare.
Absolutely. Thank you for having me.
This is Genetics for Healthcare, a podcast for patients.